Hello, my name's Dr. Darren Seeger, and I'm one of the doctors at Moulton Surgery based at Waterside Campus. And we just wanted to produce this short video just to you know what services we can offer to the student population. We know how difficult it is to be a student in these troubled times, and we just wanted to let you know that we are here to support you uh, with all of the other services that are available to you. Obviously, when you see a doctor, it's probably when people are feeling stressed and anxious, and there is a lot of support available to you. We mostly see the patients who are more at the severe end of what their symptoms are, and so we have doctors and nurses that can help. The vast majority of people we see with mental health issues will have elements of anxiety and depression. And what we find really, really helpful is if you do some mood assessments before you come and see us. Anyone can do these, and if you just Google 2 mood assessments. So one for depression is called the PHQ-9, and the one for anxiety is called GAD-7. And they're available on NHS websites, and if you just Google them, and they simply ask how you felt over the last 2 to 4 weeks. And you just answer the questions, and it sort of gives you a score which sort of shows where you are between being happy and sad and anxious and not anxious. And then when you come and see us or we speak to you on the phone, then we have a good gauge of what we can do to help and support you. Um, Generally, if people are suffering from anxiety and depression, the really important thing to remember is that it's a physical problem in your brain. It's very different than being fed up. And what I tell people, it's a bit like having epilepsy. That's another different problem in your brain. Or if you have asthma, it's a problem in your lungs, or diabetes, it's a problem in your pancreas. So these are all physical problems. The medical theory around that is that there's a chemical imbalance in that part of your brain that controls your mood. And really, what the outcome that you want, I'm sure, and that what everyone else wants, and for you to perform successfully in your studies, is for you to get better as quickly as you possibly can, so you can achieve to your full potential at university and in life. So if you do find yourself suffering from anxiety and depression, there are 3 main strategies that can help you feel better. So the first strategy is stuff you can do yourself, called self-help. The second one is talking therapies. And the third one is medication. So if I run through those quickly in order, in terms of self-help, there's loads and loads of websites. The ones we recommend are called Action for Happiness. And if you just Google that, it's a really well-structured website that talks you through sort of 10 steps on how you can feel better. And each of those steps, the first letter of everything you do stands for Great Dream. There's lots of apps. You can get the main one that's very popular is called Headspace. But there's obviously loads and loads available as well. The second strategy is around talking therapies, and we have a fantastic counseling and mental health service at the university. And if you haven't made an appointment to see them, they're a great first step. But I know, like us, they're very busy. So the NHS also has a telephone service that's run by a team of psychologists, and that's called IAPT, IAPT, and it stands for the Improved Access to Psychological Therapies. And if you just ring our reception, we can give you the phone number. Or if you go on the website, which is Northamptonshire Healthcare Foundation Trust, or NHFT, there it will have that number as well. So if you put IAPT Northampton into any search engine, it'll come up with a number, and you can just call them yourself. And again, they'll also ask you for what your mood scores may be, because that also helps. And then thirdly, there's medication. So we only offer medication to people with the more severe end of depression and anxiety. And of course, everyone is worried about going on medication, and that's natural and normal. What we tell everybody is that there's two main myths that are completely myths, the complete myths. First one is it will not change your personality in any way, and you will not become addicted to them. So we give them in courses, and we closely monitor patients on those medications throughout that journey. So, and the theory, the evidence around that is that it tries to balance out that chemical imbalance that I mentioned before, so that along with all the stuff you can do yourself, the self-help and the talking therapies, medication will help to get you better quicker. So I just wanted to give you a brief overview of what we can do if you ever do need our services. There's 6 doctors at Waterside campus, and 5 nurses now. So and we'll be shortly employing a mental health practitioner as well. That will be really helpful to try and support you through your journey through university and beyond. So thanks very much for watching. Goodbye.